Welcome to Doctors on Call. I'm Jenna Miller. Doctors of chiropractic treat millions of Americans each year. This includes the adjustments of infants, children, and adults. Some of the first chiropractic adjustments can actually occur when a newborn is only minutes old. Your spine may feel better after leaving a chiropractic office, but did you know that adjustments can also boost brain function, which leads to less inflammation, regulated hormones, improved muscle strength, and more? And while you may be tempted to adjust your own back or that of your friends, it's important to know that chiropractors must complete thousands of hours in classroom, lab, and clinical internships during their graduate school program. Chiropractic care is our topic tonight on Doctors on Call with our guest, Dr. Shelby Darnell of Restoration Health and Chiropractic.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Dr. Shelby Darnell grew up in Plainville, Kansas. She earned her bachelor's degree in human biology and her doctorate in chiropractic from Cleveland University of Kansas City College of Chiropractic, graduating cum laude. Dr. Darnell earned her 100 hours of functional medicine and chiropractic family practice from the ACA Council on Diagnosis and Internal Disorders. She has completed more than 300 hours of postgraduate study of diagnosis and treatment of internal disorders. Dr. Darnell recently expanded her chiropractic offices to include Plainville, Stockton, and Phillipsburg. She has also served at KC Core and Overland Park Regional Medical Center. Give us a call at 800-337-4788 toll-free with your medical questions about chiropractic care today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thank you so much, Dr. Shelby, for coming back and joining us on tonight's show. Let's go ahead and start with some questions. We were talking a little bit about in the open about adjustments being done to infants, children, and adults. How do you treat each one differently?
So for infants, the typical complaint that parents bring them in is colic, fussiness, gas, constipation, things like that. So we can adjust infants nice and gently from cervical spine, their necks, mid-back and low back, and we can help any irritability, and with constipation we try and stimulate the nerves in like the pelvic area and try and get things moving for babies. And so that is how we treat infants. For adolescents, a lot of physical activity, a lot of injuries, accidents. So we can address any of those with adjustments and some muscle work, usually do them very well. Then adults, same thing. We spend a lot of times at a desk, watching TV in a recliner, manual labor, bending over, lifting. So we address whatever complaint they have. If low back pain due to lifting, neck pain due to typing on a computer, looking down a lot, we can address those. Usually I do with some muscle work and then the chiropractic adjustment.
Sure. And at what point do you have a patient come in and you think, I don't know if I can touch you, you might need to go get an x-ray or whatnot? At what point does that happen?
Yeah, so there's red flags when we do intake forms with every new patient and then with our exams. So what we're looking for is all those red flags that they teach you. Without going into specifics, while we're doing the exams, we'll pay close attention to see. Usually severity of pain is a good indicator what they can handle for chiropractic care. If I'm not quite sure what's going on and would rather have an imaging done to make sure to see what's going on, we will refer people out for those. And a lot of times a gentle chiropractic care is very safe.
Sure, absolutely. Let's talk about why a person should choose chiropractic care.
Yeah, so anytime that you have an ache or pain, whether that be from an injury or just something that you're doing that is just uncomfortable on a day-to-day basis, a lot of times patients come in and say, this started a few months ago, but I thought it was going to go away and it just hasn't. We can take care of usually any types of those pains, or if you have a severe pain that's sharp pretty suddenly, or injuries, anything like that, I would suggest choosing a chiropractor as your first line of care.
Absolutely. And what are you were talking a little bit about the colic in the babies and stuff. What are some other conditions that a chiropractor treats?
Yeah. So I treat a lot of headaches, a lot of neck pain. A lot of people say I carry my stress in my shoulders. We can help address that. Low back pain, a lot of people know sciatica, things like that. We also do a lot of extremity, so arm and leg pains, a lot of plantar fasciitis, calf tightness, things like that we can also address.
Sure. And when a person comes into your office, what does a session with you look like?
Yep, so we'll go over, if it's a new patient, we'll go over intake forms first. We usually do vital signs, blood pressure, things like that to make sure our health is good. And then any necessary exams to try and come up with a diagnosis so that we know what's going on with the patient. And then treatment with me typically looks like some muscle work, usually 15 minutes, and then the normal chiropractic adjustment.
And why do you find that muscle work is so important?
So your muscles go from bone to bone. So any time that you are sitting in prolonged positions, or maybe you lift weights daily, or an injury, you are constantly using your muscles. Even when people think that a desk job is low impact, not tough physically, you're sitting in that position for a very long time, and so that in and of itself can have strain on the muscles. There's not a lot of times that somebody comes in and I think that the muscle work's not necessary. We loosen those muscles up, and so that the joint can move like it should without that extra tension on it, and then we adjust and put mobility into the joints, and that makes for a more effective adjustment and less pain.
Now, when you speak of the adjustment, is that the thrusting or the popping sound that a person might hear? Is that what you're talking about?
Yeah, so the hands-on pushing into that joint and giving it mobility. You will hear a pop if you gap the joint enough, but that's not always necessary. Some people just don't pop, and that's perfectly fine. We're still restoring motion to the area, and that is the whole point of the adjustment.
And do you always adjust after the muscle work, or do you sometimes have a patient come in and you only do muscle work?
There are patients that only come in and I only do muscle work, whether that's preference, they don't like being adjusted, or I just think that's what's causing their pain, and sometimes the adjustment isn't necessary, so I will do my muscle work and then I'll have them perform whatever motion or what's causing their pain and see if we've addressed that and fixed it, or if we need an adjustment.
And how does your muscle work differ from, let's say, a massage?
Yep, so I start with what is called Factor. Most people know it as Graston. It's a metal tool, and I use that to kind of scrape the area using massage lotion and biofreeze, and that just kind of warms up the area. It can break up any scar tissue or adhesions, and then I use the deep sustained pressure through the muscle. It's a little bit slower than what a massage you're used to with a massage, and so it can be a little, it depends. It can be less painful, but it's slower, so it feels good to the patient.
Sure, absolutely. And according to your website, it says that you spend about 30 minutes with each patient. That differs from other chiropractors who might get you in and out very, very quickly. A lot of times you're walk-in chiropractors, not that there's anything wrong with that, but how do you feel that is an advantage for you?
Yeah, so I love getting to know my patients, and so I ask them how they have been feeling since the last treatment to make sure that we are headed in the right direction. I make sure that there's no new falls, injuries, accidents since last treatment, and then just make sure that they feel like they're headed in the right direction. And then we lay down, we do the muscle work. That takes probably 10 to 15 minutes, depending on how many areas we're treating. And then we adjust, and then once they get back up, I make sure everything feels better, make sure there's nothing that's still going on that I think I could address the same day. Sometimes it does take a few appointments depending on how long the pain has been bothering the patient. So sometimes everything's not quick fixes, although we would like it to be, but I try to make some progress at every single appointment.
All right, we want to remind our viewers that we are talking about chiropractic care with Dr. Shelby Darnell. If you have a question for her, you can give us a call at 800-337-4788, and she'd be happy to answer that for you. Now, you've talked a little bit about the intake paperwork. Why is that so extensive?
Yeah, because sometimes, with infants, it's not very extensive, but you've been, depending on what you've done throughout your life can make your paperwork more extensive. We want to make sure we look for surgeries, any health conditions that you have, and broken bones, things like that. It's really important. People have fusions in their back. We need to know about that stuff before we adjust to make sure that we are doing everything safely and we get you the good care that you need.
Sure. And on average, how many times do you typically treat a patient?
Yeah, so this, it differs with everyone, especially how long something's been going on and how severe something's been going on. So if you have been having this pain, for a week, it might take one appointment, maybe 2 appointments, and we can usually get it gone. If you've let it go on for a few months, especially if it's been going on for a few years, it's going to take a few visits because your muscle is used to that injury, and that tissue tone is it's going to take a little bit to change the actual tone of the tissue. If you think about how you lift weights, you can't lift weights for one time and expect a big change. So same when we're trying to break back down those tight and taut muscles.
I think sometimes people correlate a chiropractor with the spine only, but you had mentioned the extremities. Let's talk about how you might adjust some of those.
Yeah, so let's use tennis, for example. So say somebody was hitting a tennis ball and had shoulder pain. It might be coming from the muscle or the actual joint. So we're going to assess that and see what's causing that. So say for a shoulder, there's 2 different ways. We can just use a manual adjustment, or we can use what's just a little drop. And so both of them are effective. It just kind of usually provider preference which one they want to use, and so we'll just put some motion into that joint and hopefully restore that mobility.
Sure. What about a person's knees? Do you work on knees?
Yes, all the time. Yep. So you actually have the femur coming down in your thigh, and then you have 2 bones in your lower leg. So the fibula is a small bone on the outside of your leg, and the tibia is the big bone. And sometimes that fibula is not moving and causing knee pain. Sometimes the tibia is not moving. We also want to check for the tight muscles. You use those muscles every time you walk, step up, anything like that. So make sure those aren't causing any pain for you, and adjust when needed.
Now, can a person who has had back surgery still come see the chiropractor?
Yep. So depending on what type of back surgery it was, especially with fusions, you're going to have tight muscles because those muscles are working harder to move those vertebrae that you have now fused together that aren't moving. So you'll have tight muscles in that area, and we can still address that area. We just won't use like a manual adjustment.
Sure. Okay, we're going to go to the phone lines. We've got a caller from Hayes ready to ask a question. Hello, welcome to Doctors on Call. Go ahead with your question for Dr. Shelby Darnell.
Hi, my name is Doug, and I'm calling from Hayes. I have a very active family, and we've been to the chiropractor some, and kind of two questions to that. One, why are you oftentimes sore after that visit? And then 2, is it okay to continue and work out the same day that you may have a chiropractor appointment?
Yeah, so sometimes you do get sore because of that force into the joint with those muscles. So if those muscles are tight and you put a force through them, sometimes that can cause soreness. Or if you're not relaxed when you get the adjustment, so say you tense up when they're pushing, that can, kind of strain those muscles, and that can be sore. Or the joint just might have some inflammation in there, and so putting that motion in there may make it sore. I think exercising and working out same day as chiropractic, you have to just kind of be aware. So say you're just getting a normal adjustment head to toe as a maintenance, you are perfectly fine to go work out. say you went into the chiropractor because you had a rib out before, you want to be careful with that because that can be something that will come back dependent on what you do. So I think that's really dependent on what you went to the chiropractor for. If you have a shoulder injury and you went and had treatment, you might not want to do shoulders that day. Or if you're working out, make sure it's not painful while you're doing it.
Okay, great information. You mentioned having a rib out. Can you explain what might be some of the symptoms of a rib being out and how that gets adjusted back into place?
Okay, so rib out really is not a technical term. And a lot of times when we say it, you think the rib like popped out of the joint, and that's not technically true. So you have some irritation in the joint where the rib meets up with the TVP of the vertebra of your spine. And so when you have a rib out, you can have sharp pain whenever you take a deep breath in. It can also just be a pinpoint area of constant pain, and that area will be tight usually, because what happens is that rib will move just slightly in that joint, and then you'll get that joint irritation. Those muscles also tighten up to prevent any further movement of that rib, and so you'll also have muscle tightness accompanying that, and it's important to decrease that tightness so that it doesn't keep pulling on that rib, and that will make a more effective treatment to not have that happen going forward.
Excellent. So a person can have multiple ribs out at the same time, is that correct?
That is correct, yes.
Okay. Now, Doug had mentioned about the exercise. How important is it for, maybe not same day, but for a person to build up their muscles? We're talking about a lot of muscle work in order for those bones and joints to stay in place.
Yeah, so exercise just in general is really good for bone health. Especially with the elderly, they say weight-bearing exercises is really good to preserve the bone density. And so all in all, for overall health, it's so important. You just have to be careful with doing anything too much. So whenever you do a lot of one exercise or build up muscles, you can shorten them and create knots in them. That same thing with prolonged exposure to sitting or looking forward, you can start getting knots in areas that can become painful. So you just want to make sure you're stretching really well, warming up really well, and then stretching afterwards.
Sometimes you'll see them cracking their neck or trying to pop their back. Can a person adjust themselves?
Technically, you can make the joints pop. Yes, you can. Adjustment is adding that mobility back to the specific joints to restore that motion. And so while you can do that, it's not effective treatment, and it usually won't relieve pain. Another warning that I always think about is same way when you start popping your knuckles, you get that feeling that you need to keep doing it. And by doing that, you can stretch ligaments to lengths that they shouldn't be, and so it not only can make like your neck especially harder to pop, because a lot of the times you're using a lot of force to get that to pop. It'll be tougher for a chiropractor to adjust.
Okay, very interesting. You had mentioned earlier in the show headaches, and what type of treatments do you recommend for, let's say, headaches or migraines?
Yeah, so sometimes headaches can just be a joint fixation in the upper neck that needs some mobility, but a lot of times I find there's a lot of muscle tightness that comes with that. So there is muscles in the neck called the suboccipital triangles. You have one on each side of your neck at the very base of your skull, and those oftentimes cause a lot of headaches. They're really small muscles, but when they get tight, they can be very painful. And so I do a lot of muscle work right at the base of the neck. I also look at like your upper trap muscles coming into the shoulders, because a lot of people, like I said, a lot of people say I carry my stress in my shoulders, and that will pull up into the upper neck. And so making sure everything's moving okay, taking that tension off of the fascia that covers the whole skull can also help.
Okay. What are some of the common sports injuries that you treat?
I treat a lot of knee pain and a lot of shoulder pain. A lot of, high school athletes get some shin splints. We can do a lot for that as well.
Okay. We are going to go back to the phone lines, I believe. We got another caller waiting to make or have a question for Dr. Shelby. Go ahead with your question. Thanks for calling Doctors on Call.
Yes, I was wondering if there's ever a time that you should just get into the chiropractor for maintenance. Maybe you don't feel bad. If that's important to every once in a while, just go to get adjusted.
Yeah, so it can be, especially because if you have joint fixations, especially in your spine that aren't yet causing pain, just a maintenance adjustment can address those and prevent further issues. Also, if you've had chronic conditions and you go to the chiropractor for a treatment plan and you're feeling great, it is good to get adjusted so you that doesn't come right back instead of waiting until you have the pain again to go in. Just having a maintenance adjustment can help prevent that from coming back sometimes.
Sure, and I think sometimes that might be a stigma of a chiropractor, is that people think you have to just keep going back and back and back. What is your goal as a chiropractor for your patients?
Yeah, my goal is to get my patients out of pain as quickly as I can and try and prevent that from coming back. So like I said, I do the muscle work. It's very effective and getting rid of pain, and then I always send my patient home with at-home recommendations for them to do stretching, heat or ice dependent, any like BioFreeze, icy hot. I always try and educate the patients before I send them out the door to make sure they get out of pain as quick as possible.
Excellent. Okay, we're back to the phone lines. We've got Lizzie on the line from Dorrance. Hi, Lizzie. Go ahead with your question for Dr. Darnell tonight. Oh, I think we lost Lizzie. So if she still had a question, she can call back, no problem. All right, you had mentioned that the stretching, how important is that to stretch, warm up, and then cool down after your exercise routine?
Yeah, so I think even stretching before you go to work every day is important too, because you're doing those same activities over and over and over again can make you prone to same injuries and those same tight muscles. So just warming up those muscles, getting blood flow to the area can prevent injuries altogether. They can also prevent the pain that you would feel had you not stretched or warmed up the area.
Sure. And what kind of chiropractic care can be given to pregnant women?
You can be adjusted when you're pregnant just as a normal adjustment.
Okay. And we've talked about this before, I think, on previous shows, but can you explain, you hear about cupping. What is cupping, and is that something that you provide at your practice?
Yeah, so cupping is using a little cup. Some of them, the ones I use are plastic, and you suction the cup. Some people use glass and use like heat to suction up, and what it does is it pulls the skin, the muscle, and the fascia up, and so that breaks up adhesions and can bring the stagnant blood out of that area. That's why a lot of times cupping is, you see bruising with cupping, and so that's just bringing that stagnant blood to the surface so your body can get rid of that quicker. That breaks up adhesions, like I said, in the fascia that can cause pain and just kind of relaxes everything in that area.
Excellent. Okay, we're going to try Lizzie one more time. She's back on the line. Hi, Lizzie. Go ahead with your question for Dr. Darnell.
Hi, I'm interested in going to chiropractic school, and I was wondering what one of the hardest parts was.
To be honest, the hardest part is the time commitment overall. It's a lot. As far as like toughest class, I would say organic chemistry, especially if you're really just not too thrilled about that type of a subject. That was my toughest class, but it's a big time commitment. I mean, it's like 8 to 5, and sometimes even later once you get into the tail end of your education, you're staying to treat patients in the clinics as well. And so it's a full-time job plus studying whenever you get home.
Okay, but it's well worth it, would you say?
Yeah, I do think it is.
Absolutely. Now, are there methods that you treat for those who are in chronic pain?
Yes, like going back to the muscle work, I always look at the muscles, what's causing that. Sometimes we can just do an adjustment to the area and provide some temporary relief, but if you've been doing something that's causing chronic pain over and over, we need to look at what you're doing on a day-to-day basis that it keeps coming back to you. So I do a lot of muscle work with those patients.
Sure. And what is e-stim therapy, and is it something that you do in your practice?
Yeah, so electrical stimulation is like an at-home TENS unit that you can use. It is some sticky pads, sometimes 2, sometimes 4, that we place on an area that what it does is it stimulates the muscle very quickly over and over again, and it can kind of numb the pain receptors in that area. It can also help relax those muscles.
Sure, we were talking about sports injuries, and what advice would you give to parents who might have young athletes in order to try to prevent those sports injuries from happening in the first place?
Yep. I would always encourage them to stretch even when they come home, after practice or before games. Always encourage them to stretch. And really, when they're young, making sure they're doing the correct form throughout their activities is so important, because when they're doing the incorrect form, you develop really bad habits, and then as you get older and things get intensified, it can really set you up for injuries.
And we just have a little bit of time left, but something that you do that's unique in your practice is you also do a hair analysis. Can you explain that a little bit?
Yeah, so hair analysis, we're looking at the hair to look at the minerals and the trace elements in that hair tissue. So it's less painful than taking blood, and it's easier because you don't have to really store the blood, in cool environments or spin down. So patients can do this at home. We take samples from usually the base of the skull, and in like hidden areas, we cut the hair at the skull in very, very small pieces. It's not a whole bunch of hair, it's just a small sample that we do. You send it off, and they do the lab work on it. The main ones they're looking at is magnesium, potassium, calcium, and sodium. It's really important. The elements are really important because they're like the spark plug for all reactions of your body. So when those are off, you can get a wide array of things, from fatigue, headaches, hormone issues. Just like magnesium is very important for proper muscle use. Sodium is an important part of your diet. They're just important to have, and once you throw them off, you can really cause issues going forward, and yeah.
Very interesting. Well, thank you so much. We are out of time, so we want to thank Dr. Shelby Darnell from Plainville for being our guest. On our next Doctors on Call, we will be discussing allergies. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.